forgot to record. Let's see. Thank you. All right. So again, my name's Allison Rollins, and I have 3 children of my own who are really big, larger than me, and I can't believe they've grown up so fast. So I have 2 daughters and 1 son. My oldest just recently got engaged, which is super exciting. So I also have a wonderful supportive partner, and I really had so many women who supported me throughout my experiences, both prenatally, birth and postpartum. And I think I was very drawn to that experience and really wanted to create the similar experience for other women. So let's get started. Thanks so much for being here. Super excited to share with you guys. All right. So welcome again. All right. So what does it mean to have a natural childbirth? Let's talk about that. So unmedicated childbirth, the labor and the delivery of the baby without drugs, has been prevalent throughout history. Really, by reducing the need for further medications, unmedicated birth really allows you to kind of fully be present both physically and mentally during your baby's birth. Also, minimizing interventions during labor can also lead to faster post-birth recovery for both you and baby. So, of course, having an unmedicated birth may not be the right choice for everyone, but you're here tonight because you're very interested in that. And it is important to be informed about what choices you have as you move through your pregnancy and decide on what you want to do for your birth and how you can best prepare for that journey. Awesome. All right. So let's first off talk about what is an epidural. And I know you're thinking, okay, Allison, I'm in here to learn about natural childbirth. But I think it's really important to look at all aspects so that you can understand all those choices out there. An epidural is known as a pain relieving intervention that birthing people can choose when giving birth. The explanation usually stops there, right? You may have read more about it, but an epidural is really just a local anesthetic injection, okay, into the epidural space, the space that is surrounding that tough protective coverings of the spinal cord, and it is injected blocks the nerve signals from sensory and motor nerves, which translates to effective pain relief and immobilization of the lower body. Okay. As of lately, there are new kinds of epidurals becoming available and allowing for more sensation in the legs, maybe some movement in the legs. That is something that you should talk with your provider about. Sometimes that's different drugs that are used, and sometimes that's different dosing methods. So regardless, the procedure is really done the same. So a catheter or a flexible tubing is inserted into the spine at the low or mid back, delivering this medicine continually. And out of that end of the tube, it's basically sprayed across the back of the spine. And in theory, this sounds great, right? You don't feel as much of the labor and everything kind of goes smoothly. You continue to dilate in the face and you feel little to no pain. You only really have to be hooked up once, and then you have this nonstop pain relief. But like anything else, epidurals have side effects, and some include somewhat dangerous drops in blood pressure, persistent headaches, trouble urinating, infection, bleeding, and damage to the spinal space. I also want to say that you or somebody you know may have had an epidural who did not take or did not work effectively. So I think mentally preparing for childbirth and the pain of the contractions of childbirth is both important, whether you're choosing to have a natural childbirth or an epidural, because if we're mentally not prepared for that, if for some reason we weren't able to get that pain relief through an epidural, it makes it emotionally challenging to continue on with labor. A super emotional challenge when a mom tries to get an epidural and it just doesn't work. So, and I will say that there are many anesthesiologists out there who are amazing and really good at epidurals. So if that ends up being your case, I hope that it will be amazing for you. Great. All right. All right. So let's talk about a little bit about intervention and what that looks like. Birth is really an incredible individual experience. Like I was saying, all women have different ideas about what birth is. Their body responds differently, and each birth that a woman has, each pregnancy, can also be very different. There's no real determining of what is right or wrong for you. It is really just important to kind of have an awareness of all of the risk associated with the many birthing interventions so that you are really equipped to make those informed decisions, right? You want to be able to have the knowledge to make the best decisions for your birth. According to national vital statistics, birthing individuals who receive an epidural have a much greater chance of needing additional intervention. So this is really important to note. And you may or may not have heard that sometimes the unfolding of interventions once the epidural is placed, or one intervention is placed, numerous interventions have sometimes to happen as well. So some of those can include vacuum extraction and also cesarean section. One obstetrician, Dr. Ryan Dickerson from Baton Rouge, says women who skip the meds instinctively push rather than exerting when they are told, which means that they have less pushing and less tearing. Other reasons to note is that they generally don't need equipment to get baby out. They're able to navigate that on their own. Dickerson also makes another interesting point. Whether women simply intend to have a drug-free childbirth or not, changes in their behavior are present throughout the pregnancy. Women who have decided that they will have a medication-free birth often make notably greater effort to eat healthy, to exercise, and to practice relaxation techniques, opposed to those who expect to utilize medication. So this is similar to what I talked about before. All right, let's talk about preparing every day. So at the moment that we find out that we're pregnant, we get super excited and we want to read and prepare and learn whatever we can to kind of make sure that we eat all the right foods to help nourish our baby and our body, and get enough sleep and all those things. And just sometimes we're more on top of that than others. I know for all of my pregnancies, I had different variations of how much I was thinking about that or preparing for that, because life happens, right? We just have other things to do. We have work, we have other obligations. And so tonight I want to share with you guys some of the things that I'm sure that you're already doing, as well as some of the things that you can kind of maybe shift or change that might really support your ability to have that natural childbirth that you really want. So of course, birth does not start when you begin labor. In fact, the main focus of pregnancy is to prepare your body to birth your baby. So in other words, every single day that you're pregnant is a part of your preparation for childbirth. Consider this. If you were looking to run a marathon, you wouldn't ignore the facts that your life, ignore factors in your life that affect your goal of running that marathon. You would exercise your body and run many miles regularly. You would ensure that you're eating enough of the right things and give your body the rest that it needs. Right? The uterus too is a large, powerful muscle that deserves that same attention. It must be strong, it must be well nourished to successfully birth a baby. So our uterus in the female body is the largest muscle of the body, besides your quadriceps. So let's talk about pregnancy nutrition, okay? I am so excited because it's going to be farmers market season soon, and I hope that we will have lots of wonderful fresh vegetables and fruits that are coming out that we can enjoy, and that's a wonderful part of being pregnant during that time. Those are things often women crave, and they're available and accessible and for us during the season. So once you're pregnant, your health and your baby's health really are something that you really want to consider. And it is really important also to pay attention just to the sources of the food that you put in your body, the quantities, and also the quality of those food that you put in your body. The main goal of proper nutrition is to expand your blood supply. So our blood supply almost doubles in pregnancy, and to the aid to that growth of your baby, your placenta, and your uterus. Other benefits really for appropriate diet include a baby that is born as a healthy weight. It also decreases your risk of birth defects, your baby's risk of birth defects, promoting healthy brain development in your baby, decreases risk of pregnancy complications such as anemias, preeclampsia, gestational diabetes, and then also lessens the prevalence of being uncomfortable in pregnancy. So those things like morning sickness, constipation, fatigue, trouble sleeping, those kind of things, and lowers the odds of you going into preterm labor. It also promotes a faster postpartum recovery and helps you balance your emotions of pregnancy. So the wonderful things. All of this can be achieved by eating a healthy diet and being conscious of your choices. So we're going to discuss 3 different principles that contribute to a healthy and nutritious pregnancy. Awesome. So really thinking about the different trimesters and the different needs that you might that your body has as you go through those 9 months of pregnancy. It is not exactly the same for each part of your pregnancy as far as your caloric intake, but we're going to talk a little bit more about the types of nutrients that you need. But I'm going to break down sort of caloric suggestions for the different trimesters. So in addition to being a doula, I'm also a certified health coach, and one of the things that I health coach in is prenatal health coaching. There's a little bit difference within each trimester in the amount of caloric intake that you need. Like the first trimester, for example, you really don't need to increase your caloric calories. So those of you who probably didn't gain a lot of weight in the first trimester, you may not have been really hungry, those kind of things. Sometimes, especially for first-time pregnancies, we don't really show our little baby bellies as soon as we sometimes like to. So there's really no change in your caloric intake, but there is a lot of nutritional needs and micronutrient needs in that time. Second trimester is when you're really upping your caloric intake. So between 300 to 350 calories. Some women that's more or less. By the third trimester, you're really putting in 500 extra calories to your diet every day. So for most healthy weight pregnant women, this looks to about 1,800 calories in the first trimester, 2,200 in the second, and then 2,400 in that third trimester. So let's talk about diet, prenatal diet. One of the things that, one of the things that I think a lot of women struggle with is water intake. And this can be easier when it's warm out because we tend to be more thirsty. And in those winter months, unless we're really active, sometimes we aren't drawn to drinking as much. But as being a pregnant woman, the recommendations for you is really around 8 glasses of water daily. Or if you want to look at it on a bigger picture, that could be a 1/2 ounce per body weight. So This is really important. As we talked about before, your blood volume increases 40% or more during pregnancy. And so you need to be able to build that blood volume up, as well as build the cells and everything in your body, and you need lots of water for that. Another aspect of the pregnancy diet is protein. So about 15 to 20% of your diet consists during prenatally of protein. The amino acids that are within protein are really those essential building blocks for cells. And this is, without a doubt, really key and important in pregnancy. The recommended daily amount is about 75 to 100 grams of protein, or 3 full servings. And I often tell people, like, if you look at protein as far as what you need, usually it's about the size of your palm normally when you're not pregnant. And that's a good indicator, because it kind of, everybody's hands are different according to their size of their body. So that's a good way to kind of look at. Also, key are complex carbohydrates. These make up about 50 to 60% of your calories. Those include whole grains, vegetables, fruits. Those are super, super important to your body. Whole grains really are one of the main sources of energy in a lot of people's diet, and they're often enriched with other nutrients needed during pregnancy, such as B vitamins and fiber. About 6 to 11 servings, or 6 to 11 ounces a day of complex carbohydrates. Complex carbohydrates can also help reduce nausea. So if you're in your first trimester, try eating some of those and seeing if that helps support that. Vegetables are really an incredible source of that vital prenatal vitamins and minerals. So the quality of the source of those vegetables and the soil that they're grown in can have a really big effect on the quality of nutrients and minerals that are in those. Vegetables are sort of a main source of vitamins A, C, also iron, magnesium, potassium, and folic acid. We recommend that you eat about 5 or so servings every day. Fruits, so important too. Fruits provide a lot of vitamin A, C, potassium, and that fiber that's so important. They're also a good source of natural energy. I work a lot of times with moms who have gestational diabetes, and one of the things that's super important when you have blood sugar issues is what's called food pairings. So when we need that more calorie intake, we're going to be doing a lot of snacking to help with adding those calories, and to be prepared with healthy snacks. I often tell those moms, I say, you know, if you're going to have some apples, make sure you have either nut butters or some almonds with them. And what that does is to really help your body be able to stabilize its blood sugar, because we're not just delivering that fruit into the body, but we're delivering that fruit along with a whole fruit of fiber plus that added protein, which helps mom's blood sugar stay at a healthier level. All right, so we talked about complex carbs, we talked about protein. Next comes fats. So our brain is a big fat globule. It's just full of fats. And so our babies need lots of healthy fats to be able to grow that brain really well. We want our babies to be as healthy as possible. And healthy fats make up about 20 to 30% of our diet. So it, in addition to brain, it's also eye development. It is also a major source of energy. So important in that aspect as well. And it also is key in absorbing specific vitamins, specifically vitamins A, D, E, and K are what's called fat-soluble vitamins. Those vitamins are readily absorbed along with the fats in our diet. So, and we also know that, or we've heard, most of us have heard that all fats are not created equal. So on my health coaching here, I have to say that it is best to avoid what's called a trans fat, okay? and also limit your intake of saturated fats, okay? Great choices for oils, I always say, are olive, coconut, walnut, avocado, those types of sesame. Fats can also be something that we get supplemented through. So it's important to note that our body needs in pregnancy about 500 to 600 extra milligrams of DHA, which is totals up about 1,000 milligrams of EPA and DHA in our diets. Who loves avocados? That is me. I could eat those all day. So salt. Salt has a really negative reputation in the health world, but it does contain an important mineral, right? Sodium. And without it, your muscles, your organs, your nerves wouldn't really function properly. It keeps your fluid in balance. So those fluids, super important as your blood volume increases. Also, iodine is usually found in salt, and this mineral is critical for your baby's brain and nervous systems developed. Most of our prenatal vitamins does have a recommended dosage of iodine on those, so you can always check that. So if you're using something like a Himalayan sea salt, just check your prenatal vitamins to see if they've got the right amount of iodine in there, and you can always check with your provider for that. So we spoke about fiber and its key importance. Fiber comes in two forms, soluble and insoluble. Okay, these two work sort of together, and they're both important, right? Soluble, fiber in general is really important because during pregnancy, our hormones really slow down our intestines, which means that food and waste products do not move as quickly. Raise your hand if you know about that. We do understand the result of that, right? And fiber is what can solve this problem. So it will absorb the water in your intestines and kind of keeps it there and helps soften the contents of your bowels and helps them keep that moving. So one of the things that you can do for thinking about fiber, especially with that insoluble fiber and balancing that soluble fiber, is really thinking about eating fruits and vegetables with their skin and peel on it. So washing them and then eating that way. It can really be helpful. All right. All right. So besides those main parts of your nutrition that you need, I want to include micronutrients. So micronutrients are also really incredibly important in your prenatal nutrition, and following like the pregnancy diet appropriate guidelines will provide you with many of those, but it may not be enough. So really talk to your provider about your diet if you're concerned or if you're not interested in taking prenatal vitamins or you're having trouble because they're making you sick. Talk with them about that and check in. A lot of people do take a multivitamin, a prenatal multivitamin, to help them get all the nutrients that they need. Many vitamins can be key, and a lot of the ones, if you have more than you need, it will just be kind of come out through your urine. So if you have questions, definitely speak with your provider. One of the some of the key micronutrients that are really important in the development of baby and in your pregnancy are folic acid or folate, right? So those, you've heard those as far as baby's brain development. Those are super, super key in that first trimester and even in preconception. So I always say, like, those are sort of my reproductive life planning micronutrient. I think all women should be taking folic acid regardless of if they think they're going to get pregnant or not. Because oftentimes by the time we're supplementing, it's kind of past that window. but it's still important for you guys to take that. And folic acid and folate are a B vitamin. You usually need about 400 extra micrograms, so about 600 to 800 micrograms. Also calcium, so notably it's important as we're growing a baby to have extra calcium. So we have about 800 milligrams extra, totaling about 1,400 to 1,600 milligrams of extra calcium in your diet. Iron is also one of those key micronutrients. We're going to be intaking about 12 milligrams additionally, so that totals about 30 milligrams total. Iodine we've already mentioned, vitamins B6, vitamins C, A, and D, zinc, and copper. Share with me in the chat bar like what your favorite prenatal vitamins are. Some of us are really drawn to like a whole foods based prenatal vitamins. Some people are into gummy vitamins. Some people have trouble with the extra iron in vitamins. So let us know what you've tried and what you've really liked. Awesome. All right. So let's talk about getting moving during pregnancy. For the most part, exercise is really safe and is encouraged, right? You may have talked to your provider already. You may be taking a prenatal yoga class. You may be walking with a friend. The two most common gauges for your level of activity are how active you were prior to becoming pregnant, and then the level of exercise that you currently feel physically comfortable with, depending on where you're at in your pregnancy. And then that pre-pregnancy exercise level is going to really kind of help you as a guiding post to understand what's going to work best for you. So experts really agree that it is important to keep active when you're expecting. And sometimes that can be hard as we're having, if we're having morning sickness or those kind of things, it can be challenging. But if you're feeling good, it's really important to keep moving. It also results in reduced back pain for most women, relief from constipation and bloating, overall lowers overall swelling that women experience. It also gives us natural additional energy. It manages our mood, improves our quality of sleep. We also have faster postnatal recovery, which is key. And you're going to have that sweet little one. Some of you are going to have it during the summer season, maybe fall. And, you know, you can get out with your strollers, get out with your friends, do whatever it is that you love to do and be able to recover in that way. And it's really going to help you because oftentimes we're stuck inside with babies and it makes us feel really good to get out. So one of the things to note is movings really can sometimes help you cope with labor. All right. The main recommendations for exercise is about 30 minutes for you every day. However, even just exercising for 20 minutes 3 to 4 times a day is really still beneficial. The main goal you really want is to get moving and get that blood flowing. So whatever feels right for you. Some people stand up and do stretches and do knee lifts in their chair. We can do neck rolls. We can do arm circles. There's just lots of different things that you can do. Sometimes I'll put like sticky notes on my, even though I'm not pregnant, sticky notes, you know, to help me remember to do things. So if that's helpful for you, to help you just get in 5 minutes, because if you do 5, 5, 5, and 5, that's 25 minutes in a day that you're moving. Especially if you're working at a desk during the day, it can really be beneficial in how you're feeling and make sure you're maintaining and strengthening all those muscles in your body. You can check out one of the pregnancy resources that I think might be helpful is called fitpregnancy.com. It's, I'll have I'll make sure that we email you guys this link. But there's a lot of good YouTube videos as well that a lot of moms really like to do. I think that a lot of women really like to continue doing what feels comfortable for them, but just modify it. So I had a client who was like really into CrossFit. So she wanted to maintain that CrossFit level. And so I just said, you know, you just need to talk with your instructor and talk about like really be present in your body and make sure that you're listening to your body, and then just keep dialing it back as you move through that pregnancy. And always check in with your provider as well, but just make sure that you have that kind of awareness of your body. It really makes a huge difference in avoiding injury. All right, so let's talk a little bit about those things that we need to be aware of. Even though exercise is really beneficial, it is important to be aware of dangers. So always talk to your provider. But if you exercise too often or too strenuously, you can restrict the amount of oxygen that reaches the uterus. And this can happen when you exercise, your blood flow moves to deliver ample oxygen to your muscles, your lung, your heart, versus your other internal organs such as your uterus. Really, to combat this is super easy, is to recommend a heart rate level to ensure baby is still getting oxygen. So just don't overdo that heart rate pace. A lot of us have access to watches and different things that can check our heart rate. So that's a good way. And you can talk to your provider about what works best for you. Everybody's is going to be a little bit different. Also, during pregnancy, your center of balance is going to change. It's gradually going to change as you get in your third trimester. And this can lead to you being more susceptible to falling. So as your pregnancy progresses, change your routine, do more low impact activities, and don't put yourself at risk for falling. Avoid these type of exercises. So exercises that may cause abdominal trauma, extensive jumping or bouncing while stretching, also waist twisting movements while standing, exercises in really hot environments like hot yoga, activities that would put you at risk for slipping or falling. Awesome. And talking about that, checking in with your body, just noting your pulse. If you ever have a difficulty speaking, you just can't catch your breath, you're having trouble speaking, any signs of dizziness, headache, or faintness, that's definitely something to listen to and kind of slow down. All right. So as we look at trying to achieve natural childbirth, we're looking at all these aspects of the body and just really supporting the body and its ability to be strong and be in optimal health. So as we look at exercise, prenatal yoga is one of those things that I think has been helpful for a lot of the women that I've worked with. Prenatal yoga community is really growing in size, and yoga in general provides countless benefits on our physical, also our emotional and mental health. It is something that I often hear women say, I feel like yoga was really helpful for me to be able to make it through birth. They feel strongly that helped them to strengthen their muscles, strengthen their mental stamina, and also to help them have awareness of their breath. So if you can find prenatal yoga, a group to practice that in your area, that's always a really good way because we're connecting with people. But if you're not able to do that, I'm going to send out some links for some other ways that you can get access to learning yoga on your own. Okay. So another aspect that I didn't mention is stretching. So within yoga, you're breathing, you're stretching, and you're also doing strength building exercises. So those muscles, you may be in a posture where you're building strength, and you also are concentrating on relaxation. So we're relaxing those muscles And all of these things are aspects of birth, which is just fascinating for me, because I really love the fact that as we go through a contraction, our body is working, this muscle of the uterus is working so hard, and it's powerful and it's contracting, and at the same time, we as the laboring woman has to relax her body and breathe and work with that uterus that is doing its really hard work of opening the base of the uterus, the cervix, and softening those tissues and stretching and helping baby to move down and out. And so yoga, I feel like, really gives us a lot of tools for that. Yes, so just my little 2 cents there. Raise your hand if any of you guys have done either yoga in the before you got pregnant or while you're pregnant. All right, so as we mentioned before, breathing is a tool that yoga allows us to practice, but it's not the only time. So breathing is also something that you can practice on your own. Breathing is a thing that we do the most and think about the least, right? It is truly essential for both you and for your baby. Some of the reasons it's so important to practice breathing, either through yoga or just some kind of practice, is that your body needs oxygen to function as your baby grows, right? Your baby requires plenty of oxygen to grow properly, and you receive relief from body aches when you have adequate oxygen in your body. One of the things when I work with a mom in labor is I tell her to imagine that your breath, as you take it in, goes all the way down your body, down all the way deep into that where your baby's head is, where your cervix is, and breathe into that. And think about providing that oxygen that your baby needs to her or him. And also think about the oxygen that your uterus needs to be able to work really well and strong and contract. And sometimes that type of imagery, or a woman's own imagery, is really helpful in them thinking about working with their bodies and with their babies to really help them be born, and to think about how amazing that organ is, that organ that your baby is growing in. It's just a beautiful thing to think about. Deep breathing really promotes relaxation and stress. So we teach our kids this in school now, take 3 deep breaths. Sometimes we call it belly breathing, helping them to get those tools to be able to calm their body, relax their body, and their mind. And so we too can use those tools in things like childbirth. You will be preparing yourself to handle your contractions by practicing this. Breathing exercises focuses on staying in the present moment, which is really priceless through that birthing process. I know that something else that I often tell to moms when I'm teaching childbirth ed is that some of the hardest aspects of getting through, especially active labor, when the body's really working hard and those contractions are coming closer together, they are stronger and they're lasting for that minute long, is that it is so key to help baby come if you're able to relax those tissues and kind of work with your body. And the support of having touch and having being in a space where you feel calm and comfortable and supported can really be essential to allowing you to be able to achieve that and to be able to have that sort of guided focus and that centering. One of the things I think is super amazing about our bodies as we're in labor is that our primitive brain shuts. Our new brain, the new part of our brain, which we would consider our communication brain, our ability to speak and talk, kind of shuts down when we're in labor. And so our primitive brain kind of switches in, because birth is just very ancient, right? And so our ability to communicate shuts down. We can't, it's not that we can't communicate, but we're more likely to shake our head or nod our head. We're more likely to give us a look than we are to talk or speak, especially in active labor and in the pushing stage. So all of those things are so important to kind of consider in understanding, especially partners there. If you're listening tonight, those are super key things. And as a doula, I really love and honor that journey, and really are there to help not only partners, but also the birth team understand where women space and hold that space for them as they're going through that. All right. So within yoga, within breathing, some women really connect with meditation. So this is centering yourself. Meditation and prayer can be really powerful in our ability to calm ourselves, to connect with our bodies and our spirituality and our faith. And it is a valuable tool that you can use to achieve that natural childbirth that you really want. There are only a few of the many proven benefits. I'm going to tell you a couple of them of meditation in pregnancy. So it really, like I said, is going to promote more calm in your pregnancy, both physically and mentally. It will also provide deep physical benefits for mom and baby. When we meditate, we're also probably going to be focused on breathing at the same time. So it's one of those things that you can kind of do in dual care. Meditating also lessens your chance of experiencing depression. So if those of you out there are concerned about that, it's something to consider and focus on. And meditation, I always say, doesn't have to be like a 30-minute meditation. Meditation can be 5 minutes, and it can be valuable, that 5 minutes. You will also have a more restful and a less interrupted sleep. It also helps ease pain and anxiety through childbirth. If you're able to meditate and be able to have that prayer, however you find, whatever you find calms you, you can use that not only prenatally, but you can also use it in childbirth. And anything that you do prenatally is going to help you prepare for that day, those hours, those days that you are in labor and journey through the birth of your child. So I always say the time put in is really valuable, however much it is. But the more that you're able to put into it, the more you're going to benefit from it. Meditation can also help with pain and anxiety through childbirth. And it can actually bring you closer to your unborn baby by creating sort of this bond. So as we meditate, we may meditate or pray over our baby, and those things are going to connect us because we're spending time focusing on that. And in our busy world, we know that sometimes if we don't make time for it, it just doesn't happen. Studies suggest that meditating throughout pregnancy affects emotional development of the baby. So who wouldn't want a calm baby? Awesome. So let's talk a little bit about breathing exercises, because we know that the breath is also a part of all these things that we've been talking about, and that you can utilize them for all of those. It is really kind of a matter of preference on how you will be implementing breathing exercises into your life. You may want to look for local meditation classes, take home ideas from yoga classes, or try guided deep breathing meditation. We will send out you some links for meditations and breathing exercises that you can try as a resource for yourself if you don't already have one. I just want to note that most of us know that they're sort of this understanding that breathing and different types of breathing techniques were often a part of what childbirth was like. Lamaze long ago taught breathing techniques. It's like the hee 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 hoo hoo hoo. Those are sort of a thing of the past. Lamaze doesn't teach those anymore either. And one of the things I think that can be really important is that you figure out your own breathing pattern and breathing techniques. And then maybe if you don't know where to start, then some of these things can be good grounding or starting points for you. All right. Let's talk about body work for mom, okay? Studies really have shown that prenatal massage therapy can really offer an array of benefits for you. Some of those benefits include reduced anxiety, depression, relief from muscle and joint pain, improved labor outcomes, hormone regulation, improved cardiovascular health, reduced swelling, improvement of nerve pain, improved circulation, and better sleep. There are many massage practitioners that are specifically certified in prenatal massage. If you want some references, please email us at info@highcountrydoulas.com. We'd be happy to share those with you. These therapists have received training on how to cater specifically to the needs of pregnant women, especially in those later months of pregnancy when your belly is really large. But there are a lot of different therapists that are out there and are available. Did any of you guys have any experience with having prenatal massage, and how did that go for you? One of the things that I want to share too that I think is super valuable is that part of our journey through birth and pregnancy, or all of our journey, really involves our hormones. And so hormones play so many key roles in our bodies physically and mentally. One of the key hormones that I talk about a lot as a doula is oxytocin. Oxytocin is the love hormone. It is the nurturing and bonding hormone. So we experience it when we bond with our mates. We experience it when we have orgasm. We experience it when we go into labor. It is the hormone that contracts our uterus. And we also experiencing it when our baby latches onto our breast to nurse and helps our uterus go back down. So oxytocin is amazing, and oxytocin is also affected when we have touch. So whether we're touched by our partners or other people, that makes us feel happy. And oxytocin is what we need to be able to go into labor. So I often tell women, I'm like, go get a prenatal massage and then go hang out with your partner. I was like, that's going to get your oxytocin flowing. I think it's a really wonderful way to spend a day when you're waiting on your baby to come. All right. So everyone's birth plan, everyone's goals are going to be a little bit different. And it is really important for you to have the birth team that is accepting of your needs and your preferences. There are many different components to that birth team. You're going to have yourself and your partner, your medical doctor or medical provider. Sometimes your general practitioner may play a role in that. And your provider may be an OBGYN and or midwife. Your doula may play a role in that. Choosing your healthcare provider, most of you probably already have that set, but it really is so important to choose somebody who you feel comfortable with. And I wish we were able to kind of choose who was going to be our provider when we gave birth, but that is not always something that we can do in this day and age, unless we choose to probably have a home birth. I think that's most providers work in practices together, so they share on-call schedules. But those who are planning to have a natural childbirth oftentimes choose a midwife, as they are trained in delivery of the baby. And some of those women have more of a natural look to pregnancy and childbirth and journey. They also may be more hands-on and spend more time with you, both in your prenatal visits and during your labor itself. It's not always the case, so I always caution people to kind of ask questions and ask other people, because there's some midwives are restricted by their policies of the hospital or their provider to be able to support you, and meaning that they may have several people that they are supporting simultaneously. So a doula, as a doula, I can speak personally to this, is I feel like our ability to be an asset of the birth team is instrumental in the fact that we are always available and that we work for you. So we are not employed by a hospital or by a provider, but we're employed by you. And so we're there when you need us, how you need us, and we, our whole focus is really to help create the experience of those goals that we've talked about and those wishes and dreams that you have talked about over those months of your pregnancy. We also want and understand that the experience is also about creating family and creating that memory. And also, if we know that doing that together with your partner is going to create a stronger bond for you and your partner, we've seen that time and time again. And so part of our goal as doulas is also to manifest a wonderful experience for both of you, so that your journey into parenthood is very strong and tight and bonded. So we do a lot of that. Doulas are generally knowledgeable about the birthing process, and we do provide just that emotional, physical, and educational support throughout that entire experience. Awesome. So as I was speaking to partners' roles, one of the best ways to ensure a positive natural birthing experience is to have the people that you trust will meet your physical, emotional, and informational needs. Spouses are, of course, going to meet a lot of those needs. Spouses, partners, that also might be a best friend, or it might be a close family member. They have the responsibility of providing that emotional and physical support for you. And above all, they can help you. They know you best. So that's what's key. And they're there for you and stay with you. So being able to navigate, understanding, taking childbirth education classes together, and being a part of that journey through your prenatal visits can really help bond you through that pregnancy, which will help support you in that experience as you walk into that goal of natural childbirth. But just because you are preparing for natural childbirth does not mean that you cannot go to a hospital, right? So I always say, as a doula, I'm always like, you want to have natural childbirth? Let me help you have that wherever you want to have it. You, depending on where you live, your options, you may only have the options of hospital. You may have also home birth. You may have a birthing center. So everybody's going to have a different option. Decision is often made alongside, your birthing team, you and your partner and whoever else is a part of that team. And if you do intend to have, your hopes are to have that natural childbirth, is to find out information. So some of the things that we find out as doulas are, what is the hospital cesarean rate? right? What is their episiotomy rate? What are their induction rates? What are their use of Pitocin rates? Are the cords cut immediately, or do they allow the cord to have to pulse before they clamp it? Do babies routinely room in with you, or are they in a nursery? And what are those birthing rooms like? What kind of support do they have to have numerous people there? How many people do they allow in the birthing space? So your childbirth experience is yours. It's incredibly powerful, yet also vulnerable. It's also a very vulnerable experience, and it is best to be aware and also confident in the place that you're planning to give birth, to ensure that you will not be taken advantage of or misunderstand the expectations. A couple more important tips here to prepare for that unmedicated birth that you're trying for. Some families that we work with really find support through online pregnancy groups in their area. They ask questions, they get references and referrals. I always tell moms and dads to take these with a grain of salt because everybody's experience is different. So just take note of that. Another way that we prepare is to take childbirth education classes and different classes on postpartum and breastfeeding, if that's something that you're hoping for. Also important to envision those birth expectations. I think a good way to do that is to sit down and craft a sort of birth plan with you and your partner, and then talk and communicate those needs to the birth team. So before you step into that labor, make sure that you're talking and understanding what that looks like. If your expectations don't meet what your provider is able to give you, then there's going to be conversations that need to be had about that. One of the things that I do as a doula is I often help parents formulate the questions before they go into their provider, so that they have those written down and they can kind of ask those questions and get the answers that they want and need. Also, learning and practicing natural pain relief techniques that are going to work for you. One thing I didn't mention in here is hypnobirthing. I've had a lot of people email me lately about hypnobirthing, and I think that hypnobirthing can be really amazing tool for some women to achieve natural childbirth. My one limitation with hypnobirthing is that in our area, there's no practitioners or providers that teach hypnobirthing, at least that I know of. Raise your hand if you know somebody. And you would have to do that practice on your own, which means that you have to be very pretty adamant and religious with keeping track of practicing that. I don't think hypnobirthing is very valuable if you're just going to do it a little bit. Like if you're going to do it, it's like you got to commit. So just that, I just want to make that quick note. So educate yourself also about natural childbirth as much as you can. It's super key. The most important piece of this is believing in yourself, trusting the fact that we have given birth for forever, and that our mothers and our grandmothers have given birth. The female body is designed to grow another human efficiently and welcome them into the world. Whenever you begin to feel nervous, afraid, anxious, remind yourself that birth is a natural function and that you have been designed to do it. A couple of additional resources, and I think Casey's going to maybe post these for you. I have a bunch here in my office. Ina May's Guide to Childbirth by Ina May Gaskin, Gentle Birth Choices by Barbara Harper, Pregnancy, Childbirth, and the Newborn by Penny Simkin and several other authors, Birth with Confidence by Rhea Dempsey, The New Active Birth by Janet Velasky, Thinking Woman's Guide to a Better Birth by Hempsey Goer, When survivors give birth, this is a specific resource for women who are survivors of any type of trauma. The Birth Book by Dr. William Sears and Martha Sears. Childbirth Without Fear by Dr. Grantley Dick. Baby Catcher, Chronicles of a Modern Midwife by Peggy Vincent. The Birth Partner, also by Penny Simpkin. Mindful Birthing by Nancy Bardacki. Birthing from Within. If you're interested in art and natural childbirth, that's a great book. And then also Natural Childbirth, The Bradley Way by Susan McCluskey. All right. Wow, you guys stayed with me, hopefully. That was really long. Thanks so much. Congratulations on your pregnancy and your upcoming birth. I love really sharing this type of information with people who are really eager to learn and to teach others and truly take charge of their childbirth experience and their pregnancy. If you have any further questions, please post them in the chat. And I'm going to stop sharing screen so we can answer some of those questions for everybody. All right, thanks again. If you need to leave, feel free to go ahead and leave. Yay. All right. I'm going to scroll back through here and just be sure. Thanks so much for all of y'all's insights. This is amazing. All right. Kala says prenatal mini has been good for me. So yes, I love those mini vitamins. Those are definitely helpful when swallowing large pills are not an option for you. Julie's taking the Mega Food Baby and Me. Awesome. Fantastic. And all right. So let's see what else we have in here. All right. Bianca, you said your over-the-counter vitamins have made you sick. So I'm sorry to hear that. I definitely will, if you'll email me, I'll send you some possibilities for options for that, and definitely talk to your provider. Let's see. Bianca, just had one 2 weeks ago. It helped me with my joints and muscles. So I'm assuming, Bianca, you're talking about prenatal massage, and that's awesome that you're choosing to value that as a part of your therapy and your goals for achieving natural childbirth. Always ask those practitioners different things about themselves, about yourself as you're doing that. Oh, thanks, Kala. My name is Allison, but yes, Samantha Lee Wright is the co-owner, and she is, this is her Zoom, so it's got her name up here. All right. Well, I'm super excited for everybody who made it out tonight, and thanks again. Be sure and email us with your questions. We'd love to share with you more about what we do as doulas, and I wish everybody the best of luck for your birth. So awesome. Maybe you're part of getting ready. Yay. Yay, Bianca. I really love massage, and what I do is often go around and ask and get massages from all the prenatal massage therapists so I can give people insight into the different therapists and kind of connect them with the right person for them. So awesome. Thanks, Mandy. Thank y'all all for being here tonight. Thanks to Casey and Claire for helping manage and putting in those references on the chat bar for us. All right, y'all have a wonderful rest of your week, and I'm so glad that you came out. Be sure and check out our other webinars that are upcoming. and we hope that you'll register for any of those. We also have upcoming childbirth education classes that include different modules, either the birth. We also have a infant feeding, which covers breastfeeding, as well as bottle feeding, as well as pumping, and all the tips and tricks for that. Then we also have one called early postpartum that covers all things baby, baby care, baby comfort, baby cues, as well as mother recovery. So if you check out our website for those, you can go ahead and register online for those. We'd love for you to join us. All right, good night, everyone.